Breast cancer is a complex disease with many possible causes. It is the result of abnormal growth and division of cells in the breast tissue. While the exact causes of breast cancer are not fully understood, there are several factors that have been linked to an increased risk of developing the disease. In this article, we will discuss the possible causes of breast cancer. 1. Genetic factors. Inherited gene mutations are a significant factor in the development of breast cancer. Women with a family history of breast cancer are at a higher risk of developing the disease. Mutations in the BRCA1 and BRCA2 genes are responsible for a significant proportion of breast cancer cases. These genes are responsible for repairing DNA damage, and mutations in these genes can increase the risk of developing breast cancer. Women who inherit a mutated copy of either the BRCA1 or BRCA2 gene have a significantly higher risk of developing breast cancer. 2. Age. Breast cancer is more common in women over the age of 50. As women get older, their risk of developing breast cancer increases. The risk of developing breast cancer doubles every 10 years until menopause, after which the increase in risk slows down. 3. Hormones. Hormones play a significant role in the development of breast cancer. Estrogen, in particular, can promote the growth of breast cancer cells. Women who have higher levels of estrogen in their bodies, either naturally or as a result of hormone replacement therapy, HRT, are at a higher risk of developing breast cancer. Hormonal contraceptives, such as birth control pills, can also increase the risk of breast cancer, although the risk is small. 4. Lifestyle factors. Several lifestyle factors have been linked to an increased risk of developing breast cancer. These factors include A. Alcohol consumption. Women who drink alcohol are at a higher risk of developing breast cancer. The risk increases with the amount of alcohol consumed. B. Obesity. Women who are overweight or obese are at a higher risk of developing breast cancer, especially after menopause. C. Lack of physical activity. Women who are physically inactive are at a higher risk of developing breast cancer. D. Diet. A diet high in fat and low in fruits and vegetables may increase the risk of breast cancer. 5. Environmental factors. Exposure to certain environmental factors may increase the risk of developing breast cancer. These factors include A. Radiation exposure. Women who have received radiation therapy to the chest area, such as for the treatment of Hodgkin's lymphoma, are at a higher risk of developing breast cancer. B. Chemical exposure. Exposure to certain chemicals, such as those found in pesticides, may increase the risk of developing breast cancer. 6. Other medical conditions. Certain medical conditions have been linked to an increased risk of developing breast cancer. These conditions include atypical hyperplasia. Women with atypical hyperplasia, a condition in which there are abnormal cells in the breast tissue, are at a higher risk of developing breast cancer. Dense breast tissue. Women with dense breast tissue are at a higher risk of developing breast cancer. Dense breast tissue can make it more difficult to detect breast cancer on a mammogram. Conclusion: breast cancer is a complex disease with many possible causes. While some risk factors, such as age and genetics, cannot be changed, there are steps women can take to reduce their risk of developing breast cancer. Maintaining a healthy weight, being physically active, limiting alcohol consumption, and avoiding long-term hormone replacement therapy are all steps women can take to reduce their risk of breast cancer. Additionally, women with a family history of breast cancer or other risk factors may need to undergo more frequent screenings and may be candidates for genetic testing. If you are concerned about your risk of developing breast cancer, talk to your doctor about steps you can take.